You've taken your pills. You follow your doctor's orders. And yet, something doesn't feel right. The fatigue, the shortness of breath, the strange rhythm in your chest. Could it be age? Or could it be the very medications meant to protect you? Hi, I'm Dr. Minh Tran, and you're watching Senior Mental Health, where we speak the truth about aging with strength, clarity, and compassion. Today, I'm going to reveal the hidden dangers inside your medicine cabinet. I'm talking about 7 common pills, taken by millions of people over 60, that might quietly be weakening your heart. And the worst part? They often don't show symptoms until the damage is already done. But this is not a fear story. It's a wake-up call. It's a guide to help you ask the right questions, spot the red flags, and protect yourself and your loved ones. And I promise, by the end of this video, you'll know exactly what to watch out for, what to ask your doctor, and how to regain control over your medication and your health. So grab a notebook, call a family member to watch this with you. This may be the most important 20 minutes you spend this year. Because your heart deserves more than trust. It deserves the truth. She came into my office on a cloudy Thursday morning. 83 years old, neatly dressed, steady on her feet, but something in her eyes gave her away. She wasn't here just for a checkup. There was a quiet distress behind her calm voice as she described a heaviness in her chest, fatigue, and a fog she couldn't shake off. She was on 11 medications. 6 of them prescribed over 5 years ago. 4 of them had never been re-evaluated. 1 had recently been doubled in dose by another clinic. She had no idea which pill was helping and which might be hurting. She followed instructions, trusted her doctors, and hoped her symptoms would settle down. But they didn't. In fact, they got worse. And now, she was scared, not just about her heart, but about her body feeling like it was no longer hers. She looked at me and asked, "Am I just getting old, or is something else wrong?" That question stayed with me for days. Because it wasn't just about her, it was about millions of seniors asking the same thing in silence. Growing old brings with it more than gray hair and wrinkles. It brings subtle shifts deep inside the body that change how we react to the world, and to the very medications meant to help us. Most people don't realize that our bodies process drugs very differently at 70 than they do at 40. The stomach empties more slowly. The liver becomes less efficient at breaking down chemicals. Kidneys filter waste more gradually. Body fat increases, while lean muscle mass decreases. This means fat-soluble drugs can stay in the body longer, and water-soluble drugs may become more concentrated. In other words, medications that once served us can become harmful over time, not because the drugs change, but because we did. Our internal landscape shifts. Yet, prescriptions often remain the same. This disconnect can be silent but dangerous. A medication that helped us sleep might now interfere with breathing at night. A pill that once relieved pain could now be taxing the heart. A drug meant to control blood pressure may now cause dizziness or slow the heart too much. And all the while, the patient, trusting, dutiful, unaware, takes each tablet every morning, never suspecting that the culprit might be inside the pill bottle. As we age, we also develop what medicine calls comorbidities, multiple health conditions at once. Diabetes, high blood pressure, osteoarthritis, insomnia, and depression can all coexist in one individual. To treat these, doctors often prescribe multiple medications, an approach called polypharmacy. While well-intentioned, polypharmacy can create a cascade of side effects. One medication may cause drowsiness, so another is added to improve alertness. A third might raise blood pressure, so a fourth is introduced to bring it down. And so the cycle begins. Before long, it's difficult to tell which symptoms come from disease, and which come from the drugs themselves. This is particularly dangerous when it comes to the heart. The heart is a delicate, responsive organ. It adapts to stress, oxygen levels, fluid balance, and hormones. Medications that interfere with this system, whether intentionally or as a side effect, can tip that balance in subtle but life-altering ways. Some may slow the heart rate too much, causing fatigue and confusion. Others may retain fluid, straining the heart and leading to swelling or shortness of breath. And still others may cause irregular heart rhythms, increasing the risk of stroke or cardiac arrest. Often, the first signs of trouble aren't dramatic. They're just small changes, needing more naps, skipping social visits, losing appetite, They're easy to dismiss as just aging, but they might be the early warnings of something more serious. And they deserve attention. There is also an emotional layer that is often overlooked. When seniors begin to feel worse instead of better, many blame themselves. They assume it's just part of getting old. They worry about being a burden. They don't want to question their doctor's choices. So they stay silent. But silence allows these hidden risks to grow. And without open conversation, medications that once offered relief can slowly erode health instead. That's why it's so important to empower seniors, and those who care for them, to understand what's really happening inside the body. To ask the right questions. To recognize the difference between a natural decline and a drug-related side effect. To know when a medicine might be doing more harm than good. And to trust that it's not only okay, but essential, to speak up. In traditional medicine systems like Ayurveda or Eastern medicine, aging is not seen merely as decline. It's seen as a time of refinement. A time when the body becomes more sensitive, more selective, more in need of gentle, supportive care. Modern pharmacology, however, doesn't always adapt to that principle. Many clinical trials for medications don't include a large number of older adults. Drug doses are often standardized based on younger bodies. Side effects that appear in older populations may not even be listed on the label. This leaves seniors vulnerable, exposed to therapies that haven't been truly tested in people their age. It also leaves many doctors working without the full picture. Unless a physician specializes in geriatric care, they may not always be aware of how profoundly the aging process alters drug response. That gap between practice and physiology is where many of the risks arise. But it doesn't have to be this way. There are practical, compassionate solutions that can reduce harm and improve quality of life. The first is awareness. Simply knowing that medications affect the aging body differently is a powerful step. It helps patients become active participants in their care. It encourages caregivers to monitor not just physical symptoms, but emotional and cognitive shifts as well. It allows doctors to approach prescribing with greater precision and caution. And it opens the door to alternatives, both pharmacologic and non-pharmacologic, that may be safer and just as effective. Let me share another story. A man named George, age 79, came in complaining of extreme fatigue and poor balance. He had fallen twice in the past month. He was taking 5 medications, including one for sleep and one for anxiety. After a detailed review, we realized the combination was suppressing his central nervous system and reducing blood pressure too much at night. We adjusted his regimen, replaced one drug with a safer alternative, and added a few lifestyle strategies to support sleep. Within 2 weeks, he reported improved energy and no more falls. His confidence returned. He started attending his local senior yoga class again. Sometimes, healing doesn't require more medicine, it requires less. Done more mindfully. Another patient, Doris, was taking a common pain reliever daily for back pain. She thought it was harmless. But over time, it was raising her blood pressure and reducing kidney function. After reviewing safer pain management strategies, including physical therapy, targeted movement, and occasional topical relief, we were able to help her reduce the drug and feel stronger overall. The difference wasn't just physical, it was emotional. She no longer felt dependent. She felt in control again. These stories are not exceptions. They are increasingly common. They remind us that medication should serve the body, not control it. That treatment should evolve as the body evolves. And that every senior has the right to feel safe, informed, and heard. So if you are over 60, or you care for someone who is, I urge you to stay with me. In the coming segments, we'll take a closer look at specific medications that may be quietly harming the heart. Especially in older adults. We'll break down how they work, why they're prescribed, and what the alternatives might be. We'll also explore the early warning signs that something isn't right, and what you can do about it. Because this is not just about drugs. It's about dignity, about agency, about choosing how we age, and not letting that choice be made silently by a chemical formula. Stay with me. This journey may change the way you see medicine, and perhaps even extend the quality of your years ahead. NSAIDs, non-steroidal anti-inflammatory drugs. NSAIDs, short for non-steroidal anti-inflammatory drugs, are medications commonly used to manage pain and inflammation. They include popular over-the-counter options like ibuprofen and naproxen, and prescription medications such as diclofenac or celecoxib. These drugs are especially common among seniors dealing with arthritis, joint stiffness, back pain, and chronic inflammation. The reason for their widespread use is simple: they work. NSAIDs reduce inflammation and pain by inhibiting an enzyme called cyclooxygenase, COX, which plays a role in producing prostaglandins. Prostaglandins contribute to inflammation, swelling, and pain, so reducing them gives fast relief. However, these medications are not without risk. Particularly for seniors, long-term or high-dose use can quietly and progressively strain the heart. NSAIDs can lead to fluid retention, increased blood pressure, and even heart failure. They can also interfere with medications used to manage heart disease, reducing their effectiveness or compounding their side effects. In people with already weakened hearts, the use of NSAIDs is like adding a load of bricks to a cracked bridge. I recall a patient named Mr. Peterson, a 74-year-old former school principal with a gentle smile and chronic knee arthritis. He had been taking naproxen daily for years. Though his pain was manageable, he began to experience swelling in his lower legs and found himself breathless after walking a single block. It was initially attributed to aging, but further tests revealed early-stage heart failure, worsened by chronic fluid retention. Once his NSAID was discontinued and replaced with a safer regimen, his symptoms improved significantly. Another case was Mrs. DeLong, 80, a vibrant gardener who had started ibuprofen daily for wrist pain. She didn't notice much change at first, but after 6 months, her blood pressure had climbed dangerously high. She was unaware of the connection until her cardiologist reviewed her medication list. The American Heart Association cautions that long-term NSAID use, especially at high doses, is associated with increased cardiovascular events, including heart attacks and strokes. Even among people with no prior history of heart disease, the risks are non-negligible. What are the alternatives? For pain, especially chronic joint pain, topical NSAIDs like diclofenac gel offer relief with less systemic absorption. Acetaminophen, while not anti-inflammatory, is generally safer for the heart when used within proper dosage limits. Physical therapy, Tai Chi, and acupuncture have shown strong evidence in improving chronic pain without medication. For those with arthritis, omega-3 supplements, anti-inflammatory diets, and weight reduction can reduce joint stress. Before continuing any NSAID for more than a few days, especially in seniors, it's essential to discuss with a healthcare provider. What helps today shouldn't harm tomorrow. Blank. Blank. Thiazolidinediones, glidazones, type 2 diabetes medications. Thiazolidinediones, also known as glidazones, are a class of medications used to manage blood sugar levels in people with type 2 diabetes. They include drugs like pioglitazone and rosiglitazone. These medications improve insulin sensitivity, making it easier for the body's cells to absorb glucose. For patients struggling to keep their A1C in range, glidazones can offer significant benefit. However, these benefits come at a hidden cardiovascular cost. Glidazones increase the risk of fluid retention and can cause or exacerbate heart failure. Especially in older adults, they act on receptors that increase sodium reabsorption in the kidneys, leading to more water retention in the body. This excess fluid can overload the heart, especially if it's already weakened by age or previous disease. Let me tell you about Mr. Tanaka, a retired tailor in his late 60s, who had been managing diabetes for a decade. His doctor added pioglitazone to his regimen to lower his blood sugar. Within weeks, his ankles began to swell, and his weight increased by nearly 5 pounds. He thought it was just dietary. A month later, he collapsed from acute heart failure. In the hospital, doctors connected his decline to the new medication. After stopping the drug and starting diuretics, his condition stabilized. Another patient, Maria, 72, had no prior heart issues. She started rosiglitazone and didn't notice any major side effects at first. But slowly, she began to feel fatigued, short of breath, and unable to climb stairs. Her doctors initially suspected lung problems, but an echocardiogram showed left-sided heart failure. The drug was quietly damaging her heart's ability to pump. A 2010 meta-analysis published in JAMA highlighted a 42% increased risk of heart failure with the use of rosiglitazone. Later guidelines recommended avoiding glitazones in patients with even mild heart failure or risk factors. So what are safer choices? Metformin remains the first-line treatment for type 2 diabetes and has neutral or beneficial effects on heart health. Newer medications like SGLT2 inhibitors, e.g. empagliflozin, dapagliflozin, not only lower blood sugar but have shown protective effects against heart failure. Lifestyle changes, particularly regular movement, weight control, and reduced carbohydrate intake, remain fundamental and often underused tools in managing diabetes. Patients over 60 taking thiazolidinediones should ask their doctor whether safer alternatives are appropriate. Heart health should never be sacrificed for blood sugar control. We must aim for balance. Not just numbers. Blank. Blank. Sedative hypnotics, sleeping pills. Sedative hypnotics are medications prescribed to help with sleep. They include drugs like zolpidem, Ambien, esopiclone, Lunesta, and older benzodiazepines such as diazepam and temazepam. For seniors, insomnia is a common complaint, often due to chronic pain, stress, or changes in circadian rhythm. Doctors often reach for sedatives to restore sleep. These medications, however, come with serious consequences. They act on the central nervous system to promote drowsiness, but also suppress key neurological functions. This includes reducing respiratory drive, slowing heart rate, and impairing judgment. In the elderly, the body metabolizes these drugs more slowly, leading to accumulation and extended side effects. One major cardiovascular concern is their impact on breathing. Many seniors unknowingly suffer from mild sleep apnea. Sedatives can worsen this condition by relaxing airway muscles, leading to oxygen drops during sleep. The heart then struggles through the night, compensating for these dips, increasing the risk of arrhythmias, heart attacks, or strokes. I remember Lily, a sweet woman in her late 70s, who was prescribed zolpidem after her husband passed. She began sleeping more deeply, but she often woke up groggy and confused. Her family noticed she would nap during the day, and her memory was declining. After a mild stroke sent her to the hospital, doctors noticed her oxygen saturation at night was low. They suspected her sleeping pills had exacerbated underlying sleep apnea. Another patient, Mr. Chung, had been on lorazepam for over 10 years. He said it was the only way he could sleep. Yet, each morning, he felt dull and anxious, needing caffeine to stay alert. Over time, he developed an irregular heartbeat. A cardiologist later explained that chronic use of sedatives was a likely contributor. According to a 2015 study in the British Medical Journal, sedative hypnotics are linked with increased risk of cardiac complications and sudden death in elderly patients, especially those with pre-existing heart conditions. The risk of falls, fractures, and cognitive decline is also well documented. What are the alternatives? Cognitive behavioral therapy for insomnia, CBTI, is considered the gold standard and is effective for long-term sleep improvement. Gentle yoga, mindfulness meditation, and breathing techniques can support natural sleep. Melatonin supplements, in low doses, may help realign sleep-wake cycles. Maintaining a consistent bedtime routine, limiting screen exposure before sleep, and creating a cool, quiet sleeping environment all contribute to better rest. Before continuing a sedative hypnotic beyond a few weeks, especially for older adults, it is wise to reassess the risks and explore other options. Deep sleep should heal, not harm, the heart. Technology, when used wisely, can be a powerful ally in aging well. Gone are the days when managing medications required only a paper list and memory. Today, seniors and their caregivers have access to tools that not only remind them to take medications but also track symptoms, organize medical records, and even identify harmful drug interactions. These tools can help prevent complications before they start. They empower older adults to regain a sense of control and clarity in their daily care routines. One of the most useful tools for seniors today is a health tracking app designed specifically for older adults. Unlike generic health apps, these are created with simplicity, readability, and senior-specific features in mind. They allow users to enter all their medications, including dosages, timing, and purpose. They can set reminders for each pill, record side effects as they happen, and share these records with caregivers or doctors during checkups. Imagine this scenario. A 76-year-old man starts a new blood pressure medication. He notices that within 3 days, he feels more fatigued and has trouble staying awake after lunch. Using a tracking app, he logs this side effect each day. At his next doctor's visit, instead of relying on memory, he shows a clear pattern of fatigue that started after the new prescription. This information leads to a change in the dosage, and within a week, he feels better. This is not hypothetical. This is the power of real-time awareness. Technology, in this way, becomes not a distraction, but a form of mindfulness. When used correctly, these tools help seniors become participants, not just patients, in their care. Another major benefit of these apps is drug interaction alerts. Many seniors take multiple medications prescribed by different doctors. A cardiologist might prescribe one drug, while a rheumatologist adds another, and a primary care doctor adjusts a third. These prescriptions may be safe individually but dangerous in combination. A good app will flag these interactions and allow the patient to discuss them with their physician before any harm is done. These tools can also help manage appointments, vaccinations, blood pressure readings, blood sugar logs, and weight tracking, all in one place. Some even allow the user to connect with family members, so a son or daughter living far away can be notified if mom misses a dose or logs an unusual symptom. In a time when many seniors live alone, this connection can be life-saving. For those uncomfortable with smartphones or tablets, there are also simplified devices with large screens and voice commands. Some watches and wearable devices now include medication alerts, heart rate tracking, and emergency contact buttons. It's important to choose a tool that matches the user's comfort level. No system works if it's too confusing to use. The goal is simplicity, not complexity. In addition to using digital tools, preparing for a doctor's appointment with a checklist can dramatically improve communication and safety. Too often, appointments are rushed. A patient may forget to mention a side effect. A doctor may not know about a recent change made by another provider. But with a structured checklist, nothing gets missed. Before each appointment, seniors should go through the following preparation steps. Review all current medications. List each pill, including over-the-counter drugs, supplements, and vitamins. Note when each was started, how often it is taken, and what it's for. Track recent symptoms. Have there been changes in sleep, energy, digestion, memory, or mood? Have there been any falls, dizziness, or chest discomfort? Write these down, including when they started. Bring blood pressure, glucose, or weight logs. These help doctors make accurate decisions based on patterns, not isolated measurements. Prepare questions or concerns. Write them down in advance. Even 2 or 3 questions can shape the course of care. Bring a medication list printout from your app, or written by hand. Doctors appreciate having a concise, accurate list in front of them. Now let's talk about questions seniors should ask at each doctor's appointment. These questions are not confrontational. They are expressions of responsibility. They protect your health and improve your care. Start with 1. Why am I taking this medication? Every pill should have a clear, specific purpose. If the reason isn't clear, ask. You deserve to understand why it was prescribed. 2. Is this still the best option for me at my age and with my current health? What worked 5 years ago might not be right today. Bodies change. Health conditions evolve. Your treatment should too. 3. Are there any risks to my heart or kidneys from this drug? Seniors are especially vulnerable to side effects in these organs. Even if there are no symptoms yet, ask about potential risks. 4. Could this medication interact with something else I'm taking? Don't assume the doctor knows your full medication list, especially if you see multiple providers. Clarify every combination. 5. How will I know if this medication is causing a problem? Ask what symptoms to look out for. Unexplained fatigue, dizziness, leg swelling, or confusion should not be ignored. 6. What is the plan for follow-up? Will this medication be reviewed in a few weeks? Should labs be checked? Is there an endpoint for this prescription? Or is it indefinite? Understanding the follow-up keeps both doctor and patient accountable. 7. Are there safer alternatives, especially non-drug options? In some cases, diet, exercise, stress reduction, or physical therapy may provide equal or better results than medication. Asking this question can open new paths to healing. 8. Can I reduce or eliminate any of my current medications? Doctors may hesitate to change a regimen unless prompted. Sometimes, fewer medications can mean better health. 9. If I miss a dose, what should I do? Understanding how to respond to missed doses can prevent both overdosing and underdosing. 10. Would you recommend this same drug to someone your age or your parent? This question reframes the conversation with empathy. It invites the provider to reflect personally on the decision. These questions, asked consistently, transform the clinical visit into a true partnership. They show your doctor that you are engaged, informed, and invested in your own well-being. Doctors appreciate patients who ask with curiosity and clarity, not confrontation. It makes their job easier, and your outcome better. Let's return to the idea of prevention. Prevention is not just about stopping disease before it starts. It's about reducing the risk of harm from the treatments we use. It means reviewing medications every 6 to 12 months. It means staying hydrated, eating nutrient-rich foods, and moving your body gently every day. It means asking family to be involved in your care. And it means being open to changing what no longer serves you. One woman I met, Clara, 82, had been on a sedative for sleep and a muscle relaxant for back pain. She used a medication tracker her granddaughter helped her set up. She noticed her fatigue was worst 2 hours after her morning pill. She shared that data with her doctor. After reviewing everything, the doctor eliminated the muscle relaxant, changed the sleep aid to a milder option, and advised gentle yoga. Clara felt reborn. She hadn't realized how much her medications were clouding her mornings. Now, she feels alert enough to read, call her friends, and even go out for walks. These changes didn't require hospitals or heroic interventions. They required attention. They required the right questions. And they required tools that could organize what was already happening in her daily life. For caregivers, these same tools are even more essential. They allow them to advocate with confidence. They allow them to monitor their loved ones without intrusion. They make caregiving smarter, not harder. If you're a family member of a senior, help them install a trusted app. Review their medications together. Help them write down questions before their appointment. And most importantly, encourage them to speak up. No one should feel powerless in their health journey. With the right tools and the right mindset, every senior can reclaim control. Not through defiance, but through awareness. Not through fear, but through wisdom. These are not just practical tips. They are acts of self-respect. They are tools for extending not just life, but the quality and dignity of life. When we step back and take a wide-angle view of how medications are used in senior populations, the picture is both illuminating and deeply concerning. Across the globe, older adults are prescribed more medications than any other age group. In many cases, this is a reflection of their complex health needs. But in others, it's a symptom of something more systemic, a culture that equates more prescriptions with better care. This culture didn't arise overnight. It evolved from decades of well-intentioned medical practice, pharmaceutical influence, and the growing specialization of healthcare. As life expectancy increased, so did the number of chronic conditions we needed to manage. As new drugs emerged, the pressure to use them mounted, not only to treat disease, but to preempt it. Doctors are often trained to do something, and in many systems, writing a prescription is the fastest way to act. But when we prioritize action over reflection, and medication over understanding, we risk losing sight of the human body's natural wisdom, especially in its later years. For seniors, the result is a landscape filled with pillboxes, morning routines defined by dosage charts, and cabinets lined with bottles they don't fully understand. Many take medications without knowing what they're for. Some live with persistent side effects because they assume they're just part of aging. Others bounce between specialists, each adding a new prescription to the list. What's missing from this picture is not medical expertise, but integration. What's missing is the voice of the patient, invited and empowered to participate in decisions that affect their daily lives. In many ways, the senior medication culture has become passive. It tells older adults to take this and trust. It assumes silence equals compliance, and compliance equals success. But health is not passive. It's dynamic, and aging does not erase a person's ability to choose. In fact, the older we get, the more important those choices become. That's why self-advocacy must become a central principle in every senior's healthcare journey. To advocate for yourself is not to argue or oppose. It's to ask with clarity. It's to seek understanding before saying yes. It's to honor your experience, even if it conflicts with what's on the label. If you feel a medication is making you worse, you are not being difficult, you are being observant. If you ask your doctor about alternatives, you are not questioning their knowledge, you are partnering in your care. If you bring a list of questions to your appointment, you are not being dramatic, you are being responsible. We must shift the culture from blind adherence to informed dialogue. That shift begins with small moments. Asking, "Do I still need this medication?" Saying, "I noticed I feel dizzy every afternoon after I take this pill." Wondering, "Is there a simpler way to manage this?" These are the questions that lead to safer, smarter care. They are also the questions that give you your power back. The truth is, the human body at 70 or 80 or 90 is not broken, it is refined. It is a system that has adapted through time, through illness, through loss and triumph. It carries wisdom that textbooks cannot capture. When medications work in harmony with that wisdom, they heal. When they do not, they disrupt. We cannot allow fear to drive our health decisions, fear of being judged, of being a burden, of being labeled non-compliant. Instead, we need to act from a place of respect for our bodies, our stories, and our right to be part of the conversation. Consider this. Some of the most dangerous drug side effects do not begin with dramatic symptoms. They begin with subtle shifts, a slower step, a duller mind, a quieter appetite. If you notice these changes, don't dismiss them, trace them, talk about them, investigate. Sometimes, it's not the disease, it's the dose, or the drug, or the combination. If you are caring for a loved one, remember, your role is not only to distribute medications, it's to notice, to advocate, to ask, to document changes, to remind them and their providers that the goal is not just survival, but vitality. Health is not defined by how many medications you can take without collapsing. Health is the ability to wake up and feel like yourself. It's the strength to walk to the mailbox, the clarity to remember your neighbor's name, the peace of sleeping soundly without chemical sedation. Medication should support these goals, not steal them. And when it does steal them, it's okay to say, "Something's not right." That one sentence can be the beginning of a better life. Many seniors worry that by speaking up, they will offend their doctor or complicate the process. But the best doctors welcome informed patients. They are relieved when someone says, "I've been tracking my symptoms." They want partners, not passengers. And you, as the person living in your body, are the expert on your experience. Never let a white coat make you forget that. This journey of understanding medications is not about eliminating every pill. It's about making each one count. It's about replacing habit with intention. It's about checking in, not just checking boxes. There is no badge for taking the most prescriptions. There is no prize for never questioning a drug. The true victory is feeling well, living fully, and aging with awareness. So, what do you do next? You begin. You start with one conversation. You write down one symptom you've been ignoring. You ask one new question at your next visit. You explore one tool that helps you track your health. One small act of curiosity can ripple into a lifetime of change. And if you feel overwhelmed, remember this: you are not fragile. You are informed. You are not helpless. You are discerning. You are not alone. You are supported by a growing movement of seniors who are rewriting the story of aging. You are not here to fade. You are here to choose, to advocate, to understand, to thrive. So now you know, not all pills are created equal. And not all treatments age well with the body. What started as help can quietly turn into harm, unless you ask, track, and speak up. This isn't about blaming your doctor. It's about becoming your own best advocate. About saying, "I want to understand my body, not just medicate it." Because informed patients live longer, stronger, and better. You are not just a senior. You are someone with decades of experience, resilience, and wisdom. And you have every right to ask questions, to seek better answers, to choose your path forward. If this message spoke to you, please share it with someone you care about. Help them protect their heart, just as you're learning to protect yours. And don't forget to subscribe to Senior Mental Health. Because here, we don't treat aging as a problem. We treat it as a privilege, one that deserves thoughtful care, honest guidance, and empowered choices. You are not fragile. You are informed. And you're just getting started.